The most common vitamin sold in the senior aisle of every American pharmacy is calcium. Roughly 60% of women over 60 take a daily calcium supplement, usually with vitamin D, usually on the recommendation of a doctor who told them it would protect their bones. 15 years of research has now shown that those daily pills don't prevent fractures any better than calcium from food. They may not protect bones meaningfully in most postmenopausal women. Worse, the supplements are now linked to a measurable rise in heart attack risk and arterial calcification. The doctors who recommended these pills weren't wrong by the standards of the 1990s. The evidence then said calcium was protective. The evidence since has shifted. Most patients have never been told. I'm Dr. Gray. Let me walk you through what we now know about calcium supplements, why they aren't doing what they promise, and what to do instead if you've been taking one every morning for years. In the 1980s and 90s, osteoporosis became the headline diagnosis of women's health. Postmenopausal women were losing bone mass at a rate that frightened the medical community. The prevention message was simple: take more calcium. Doctors recommended 1,200 to 1,500 milligrams a day. Companies started fortifying orange juice in cereal. A multi-billion-dollar supplement category grew out of one logical idea: bone is mostly calcium. So more calcium should mean stronger bone. Decades later, the research caught up to that idea and found something nobody expected. The Women's Health Initiative followed over 36,000 postmenopausal women for 7 years. It remains one of the largest studies ever done on calcium and vitamin D. The result was disappointing. Supplements produced only a small reduction in hip fractures and no meaningful benefit for most other types of bone breaks. Bone strength turns out to depend on far more than calcium intake. Weight-bearing exercise matters. Vitamin D status matters. Protein intake matters. Hormone levels matter. A woman swallowing 1,200 milligrams of calcium every morning while skipping resistance training is treating one piece of a much larger puzzle, and the calcium alone can't carry the load. In 2010, a major review in the British Medical Journal found that calcium supplements raised the risk of heart attack by roughly 27% compared to placebo. The finding was disputed at first, then largely confirmed by follow-up research. The mechanism makes biological sense. When you swallow 500 to 1,000 milligrams of calcium in pill form, your blood calcium spikes sharply within a couple of hours. Your body can't use all of that calcium for bone in such a short window. So the excess circulates in the bloodstream until it ends up somewhere. Some of it deposits in the walls of your arteries as small calcified plaques, which contribute to atherosclerosis and stiffen the blood vessels over time. Calcium from food behaves completely differently. A glass of milk releases calcium slowly over hours as it digests, keeping blood levels steady and giving the body time to direct it where it should go. The multi-ethnic study of atherosclerosis followed nearly 5,500 older adults for 10 years and confirmed it. People who took calcium supplements had significantly more coronary artery calcification than people who got equivalent amounts of calcium from food alone. Same daily total. Very different outcome inside the chest. The connection between calcium supplements and dementia is newer and less settled, but worth knowing about. A Swedish study published in 2016 followed women in their 70s and 80s for 5 years. Among those who already had narrowed or damaged blood vessels in the brain, women taking calcium supplements were significantly more likely to develop dementia than women with the same condition who didn't supplement. The suspected mechanism is the same one driving the cardiovascular issue. Calcified plaques narrow small vessels in the brain, blood flow drops, and cognitive function slowly suffers. The absolute risk increase was small, and other studies haven't always replicated the finding. The signal exists in the data, the biology is plausible, and the benefit of the pill is modest enough that this risk belongs in the conversation. Some people genuinely do. A diagnosed case of osteoporosis changes the equation. A blood test showing real calcium deficiency changes it. A digestive condition like celiac or inflammatory bowel disease can impair absorption enough to require supplementation. Long-term steroid medication is another situation where the supplement may be the right call. Most healthy older adults eating a balanced diet are not in that category. The average American woman gets between 700 and 1,000 milligrams of calcium daily from food without thinking about it, and her body manages that intake well. Adding a pill on top of that pushes the daily total into the range where the harms outweigh the benefits. So, what to do instead? Get your calcium from food. The richest source is still dairy. A single cup of plain yogurt delivers about 450 milligrams of calcium, almost half a day's needs, in a form your body absorbs steadily over hours. If you don't eat dairy, sardines with the bones are one of the most concentrated alternatives in the entire food world. Before you make any decision about supplements, ask your doctor for a DEXA scan. It measures your bone density directly and tells you whether you have a real problem to address. Anxiety about aging bones is not a diagnosis. The scan gives you data. If your bone density actually is low, the most powerful intervention is resistance training. Lifting weights twice a week, done with proper form, signals your bones to grow denser through mechanical stress. No pill replaces that signal. Your bones respond to load, not to mineral availability alone. And if your doctor recommends a supplement, ask them specifically, based on my latest DEXA scan, my dietary calcium intake, and my heart health, do I actually need this pill? A real answer should sound like numbers, not a habit. If you've been taking a calcium pill every morning for the past 20 years, you didn't make a mistake. You followed the advice your doctor gave you when the science supported it. The science has moved on, and the recommendation has quietly moved with it inside medical guidelines, just not always into the conversation between doctor and patient. The bottle sitting in your bathroom may have been a reasonable choice in 2005. Whether it's still a reasonable choice in 2026 depends on your bones, your diet, your heart, and a conversation that probably hasn't happened yet. Make that conversation happen at your next appointment. The 5 minutes it takes could change the next 20 years of your life.